Squatting is a primal movement that has been done by humans since we began walking upright. Cavemen used the squat to move heavy objects and to build shelter, making it an essential movement for survival. In today's modern world, especially Western cultures, the squat is far less utilised. However, it is still an essential movement in activities such as getting up and down from the chairs and the toilet. Most children use the squat as a functional way to sit, but as we age we stop doing this and our joints become tight and restricted. This results in people opting to flex their backs to pick up objects rather than squatting. This leads to many of today's injuries, especially in the spine. For this presentation I'll break the movement down into eccentric or lowering phase and the concentric or up phase, highlighting faulty movement patterns and biomechanical deficits throughout the movement, and providing suggestions for biomechanical alterations to prevent injury and improve performance. Okay, so to start with, let's have a look at his starting position. According to Tom Walsh, 2014, from Kinesiology of Weightlifting website, both feet should be slightly wider than shoulder width apart and toes pointing out approximately 30 degrees. Now I'll just draw some lines. From these lines in the frontal view, it's clearly visible that the left hip is externally rotated and slightly abducted compared to the right. If I draw a few more vertical lines here, you can see that the compression force is far more concentrated through the right hip, knee and ankle than the left. Also, his shoulders aren't square and there is a drop to the right. This is characterised by an overall spinal curve to the right, as shown by the curved green line. In the side view you can also see that his gaze is looking down, causing forward head carriage and flexion through the upper thoracic and cervical spine in the sagittal plane. The back of his head should actually be on the red line just drawn to create a straight line through the pelvis, knees and ankles. According to Schoenfeld 2010, the direction of gaze has been shown to greatly affect spinal kinetics and kinematics in a squat. He also states that the spine should be in a neutral position throughout the squat, whereas in this video there is significant forward flexion, especially through the thoracic spine, as you can see by the curved yellow line. It's a bit over exaggerated. Now let's have a look at the eccentric or lowering phase of the movement. According to Gallagher 2013 from Fitness and Health Alliance website, the first part of the body to move in a squat should be the hips. This initial movement should include flexion at the hip joint combined with anterior pelvic tilt. This movement should then be followed by flexion of the knee joint and slight dorsiflexion of the ankle joint. In this video, however, if I slow it down, you can see that the first joint to move are the spine anteriorly. So if I slow it down, you can see instead of actually breaking from the hips, he actually begins to break from the spine, and also a little bit of knee flexion. Then last, his hips break, but instead of tilting anteriorly, it initially tilts posteriorly, causing a forward flexion through the lumbar spine instead of keeping that nice lordotic curve. Gallagher 2013 also states that the head position should not move in front of the toes. As you can see by that yellow line, his head has moved much farther forward. This causes the centre of mass to move forward onto the forefoot instead of staying over the heels where it should be. Schoenfeld 2010 highlights that when the spine moves forward, it causes a shear force to travel through the spine and increases the chance of disc herniation. This technique flaw is often the result of weak erector spinae muscles. He also states that the gaze should remain forward, as this helps to keep extension through the spine. Whereas in this you can see that his gaze is remaining down throughout that whole eccentric movement. Now if we have a look on the right, on the front-on view, you can see as he drops down, there's a noticeable shift. If I just draw a line, an initial line from his down, and then move it. You can see that there is a shift to the left as he pivots off the right hip slightly. See there. So he pivots off his right hip to compensate for the external rotation through the left hip. Yeah, you can see there. So you can see by that red line that as he has eccentrically lowered into this movement, his weight he's almost twisted around to the left, and you can see that the right foot, the weight is transferred medially onto the big toe to enable balance through that pivot. Now this movement flaw would cause a combined force of compression and shear to cause a torsion through both the hip, knee and ankle on the right leg. Over time this could potentially lead to ligament and tendon damage, primarily through the medial collateral ligament and meniscus. The weight forward would also cause an anterior shear force through the knee joint. Forward translation on the patellofemoral and tibiofemoral joints would also cause a large stress to the ACL ligament, and according to Schoenfeld 2010, 86% of restraining force through the knee during anterior shear is the result of the ACL ligament. So through this eccentric phase, the ACL ligament would be making up 80% of the restraining force, so it's putting massive stresses on the ACL, whereas if his knee was further back over his heel, there wouldn't be as much stress through that knee. If I go back to the starting position, you can see that his shoulders aren't square, as I pointed out earlier, and there's a tipping to the right hand side. So there's lateral trunk flexion to the right. This is a compensatory movement and is the result of the subject trying to move the center of mass over the right leg. This movement will cause a torsion through his right SIJ and focus more the weight through that joint. According to Bender 2010, dysfunctional glute med muscles often result in a shift away from the SIJ on the same side as the dysfunctional muscle. This would also explain the external rotation of the left hip as he tries to compensate for the lack of stability through that glute and pelvis. Walsh 2014 states that the hip joint should be just lower than the knee joint at the completion of the eccentric phase. Now you can see in the red line that that's the height of the hip joint, and the yellow line is the height of the knee. Now because of the center of mass being too far forward, his hips cannot assume the correct position even though they are at maximum flexion. As you can see by that angle there, his hips are fully flexed. However, because of the weight being too far forward, he can't actually lower down into that correct squatting position. You can also see there that all the weight's on the toes and forefoot instead of being on the heels, where you should have a nice straight line through there. The main muscles acting on the knee joint during the lowering phase include rec fem and all three vastus muscles. Again, these muscles act as dynamic stabilizers because they are required to shorten at the hip joint to allow hip flexion and lengthen at the knee joint to allow knee flexion. According to Schoenfeld 2010, the gastrocnemius has been the primary ankle joint muscle studied in squat performance. It is believed that the medial head of the gastrocnemius acts as a dynamic knee stabilizer during squatting, helping to offset knee valgus moments as well as limiting posterior tibial translation. Okay, so now let's have a look at the concentric phase of this movement. Schoenfeld 2010 states that during the up phase of a squat, the movement should first come from the knees. The movement should first come from the knees and hips, with force being transferred through the heels. Now you can see here that because his centre of mass is forward, over his feet, the force is being transferred through the forefoot and toes rather than the heels. This means that in order to push up, he has to first bend at the lower back to move his centre of mass backwards before the knees and hips can take over as the main drivers. This could be corrected by lifting his gaze, which is still pointing down, and tilting the pelvis anteriorly and placing the weight through his heels instead of being over the forefoot. Walsh 2014 states that the knees should not move past the toes at any time during the squat. Here you can see that they've moved past considerably. This increases the shear force on the ACL. Also, if we look at the front-on view, because of the external rotation through the left hip, it will cause a combined force of not only shear force but torsion through the left knee, increasing the risk of meniscus and collateral ligament damage. Okay, I'm going to go talk about moment arms briefly. According to PT Direct website 2013, a moment arm is the length between a joint axis and the line of force acting on that joint. So as you can see here, if I draw a line of force in his squat, it comes down in front of the toes. And according to Walsh 2014, the line of force in the squat should be in line with the heels of the feet. So the line of the force should really be there with the red line. Now if this was the case, which it isn't, the knee joint extensors and the hip joint extensors, because they have similar length moment arms, as you can see in yellow, would be doing similar work to lift the weight. However, because his line of force is out in front of his knees, where the green line is, the hip's moment arm is very long and is doing all of the work during the concentric, meaning the hip extensors such as the gluteals and hamstring group will be the main agonists throughout this phase, whereas according to Schoenfeld 2010, the knee extensors should be doing the same amount of work as the hip extensors throughout the concentric phase. This flaw in his movement places a lot of stress not only on the knee through anterior shear, but also on the hip joint and lower back. It will cause a large amount of shear force to travel through the lumbosacral joint, as you can see with that arrow, and could potentially compromise the lumbosacral ligaments and sacroiliac joint. Biomechanical alterations that could be made to this movement to prevent injury and improve performance would include, during the eccentric phase, keeping the head up and maintaining a neutral spine, breaking first from the hips instead of the lower back and knees with an anterior pelvic tilt, centering his weight over the heels rather than the forefoot. This should cause better spinal alignment and position according to Gallagher 2010. Internally rotating the left foot so it is shoulder width apart at approximately 30 degrees. As you can see, indicated by the green line in the frontal view, is a better foot position than it is currently. And visualize the spine staying straight without lateral flexion throughout the movement in order to keep the weight distribution even throughout both legs. During the concentric phase, lift his chest and head up and draw his abdominal muscles in, place his weight on his heels and sink into it through his hips. I would also advise him to keep his rhomboids activated through the upper thoracic, as this stops winging, whereas if he allowed winging to occur, it will draw the upper body with it and cause flexion through the thoracic. In this video, the subject's squatting technique is very poor, and there are a number of serious biomechanical flaws that, if not corrected, could lead to the potential for serious injury. The squat is an extremely functional exercise. but first the movement must be understood in order to perform it correctly and safely. I hope that this video can increase knowledge and help to iron out any flaws in technique.